All right, I'm hoping we can keep this going. Be patient. It's going to be about an hour, and want everyone to help me just go slow in the start. All right, it's the 60 minutes, and I've got to get into my other system here, and hang on a second with me, please. All right. And we're going to start with a few questions I had earlier, but just give me a moment. Please. All right. And we're going to start with... All right. And Tina. How you doing, Tina? Beautiful day. And it's snowing in upstate New York, just light. I'm sitting by the fire, a little fireside chat again. And let's see. I've been trying to conceive for about 5 years now. I've had 5 IUI failures. And last year, after laparoscopic surgery, endometriosis was found. Somewhat cauterized. Let me see if I can go to more. Be patient here. Found some large implants in the cul-de-sac, treated with Lupron. So Lupron turns off the ovaries, the estrogen is suppressed. Waiting to get my period back and start my first IVF cycle. Well, one is, you don't need to wait for your period, by the way. That was an old protocol. Fairly basic. All right, so, you know, depending on your age and ovarian reserve is really going to determine how we stimulate the ovaries. But if the Lupron has suppressed you and your ovaries are nice and quiet, you can actually start stimulation earlier. And typically we're going to use a little higher dose of gonadotropins, usually in a 300 to 450, although the standard is about 300 for about 10 days. But most of our protocols are really pretty standard. And if there's diminished ovarian reserve, we're going to add human growth hormone, DHEA, and we're going to go longer on the process before we get you stemmed. And obviously don't forget the ketogenic diet. But for many women with endometriosis, there is a certain amount of diminished ovarian function. And after some surgeries, actually, there's some evidence that it may reduce a little bit of the ovarian reserve. So a little higher dose, a combination of either just gonal and a little bit of Menopur, or gonal or follistim with some LH in the form of HCG. So I hope that's been helpful for you, Tina. Rihanna, hi from Phoenix, Arizona. Really appreciate it. Infertility factor, and have done all the diagnostic tests, HSG, sonohistogram, laparoscopy, and everything is coming back normal, which is really the most common problem we see out there. Unexplained infertility. Semen analysis and numbers were good. And remember, just because either sperm looks good or the ultrasound and all the blood tests look good, it really can be both the sperm and an egg factor in all of this. Done 6 IUIs, medications, including some injectables, unsuccessful in getting pregnant. And before considering IVF, is there anything else we can try? Well, you know, number one is, I always say, faith in the brain, so belief in thinking more positively, and then more ketogenic and paleogenic food plans. And look at Marie Emmerich, and anything we can do to reduce our gastrointestinal inflammation, which seems to be the biggest factor that just drives everything going on in the rest of our body. Interesting, I was reading a little bit about tonic water and quinine, and it has a toxic and allergic reaction for some people. My bet is so much of we put into our body causes so much more inflammation and immunologic reactions that most of us don't even understand how really, really powerful so much of what we put in our body causes those allergic reactions. So looking to narrow what you put in the body can really be helpful. Look at Maria Emmerich's ketogenic adaptation. So there's a lot on there to try to help suppress inflammation. Yoga for fertility. Tai Chi, walking, slow it down. If you've been running and doing too much epinephrine and cortisol and all those stress factors that really just adversely affect both our sperm and eggs and the environment within our body. So it really is important to slow it down tremendously. Keep on having sex and spending time with your partner, going for walks, going on dates. And again, sometimes this is so stressful. We argue and fight and we're angry, and you want to do everything you can to step away from that. That's where support group and even chatting on the CMI Fertility Facebook group can be helpful. Talk to someone who's been successful that has a similar story. What did they do? What type of things can we always learn from others in this whole process? I think that's so important. So I hope I've helped answer that question, but certainly a call to me, and I've been sharing my cell phone for some time, and I apologize if I can't get to everyone right away, but keep persistent in the process, and I'll be glad to share it again, hang out with us. Crystal, how you doing? Always wonderful. And this is a hard journey. Emotions push us down, and we want to run away. But that's where I believe positive faith comes in, and you have to believe and don't let go of belief, all right? Megan, how you doing? How do I know if we get an HCG wash and other lipids? So the HCG wash is putting in human chorionic gonadotropin into the uterine cavity somewhere 3 to 5 days before the embryo transfer. It appears to help with the stickiness in the implantation. Intralipids is a fat emulsion that's given intravenously, and it has been shown to reduce inflammation in the body, increase implantation. It's not really well understood, but that's why we really talk a lot about the ketogenic diet and bacon, eggs, butter, beef, and by consuming high fats, we suppress the intra-abdominal and the total body inflammation, and we really help increase the implantation. So really important in adding that. And so ask about it, all right? It's amazing the long list of all the things that we can throw at this thing. And sometimes it's better to step back, and we're looking at more natural methods. And that's what all this food is about, and de-stressing and changing the internal environment, right? Calm the mind, calm the body. And carbohydrates are full of piss and poop, bacteria and yeast, and you can't wash it off. And it creates a fermentation process in the gut that causes all of our troubles. And it's really interesting. Read about glycation and fermentation in the gut. So I think those are some really helpful things to look at. But intralipids are typically done a week or two prior to transfer or attempting intercourse cycle or an IUI cycle. So don't forget, all these things we're talking about are not just for IVF, but they're for natural, IUI, IVF, frozen embryo transfers, and whether you're doing a gestational carrier or donor eggs, donor embryos, donor sperm. Look at the whole process of how to help take care of your Ferrari, right? That's the really important part. We're all Ferraris in this process. And we have a great team of nurses and practitioners and doctors, and really the clients, all of our support for friends are real important. And I've been working on some problems where people are having some challenges getting into our system, and I'm really hunting it down right now. And if you're having any issues, text me, 315-416-9872. And any problems, just share it around and say, hey, text Dr. Kiltz, give me a call. Although I'm on vacation Tuesday night to this Sunday for a little bit, go spend some time with Tia. So real important, let us know what's going on. And so Jessica, thank you for your shout out. And Anita, looking to start IVF with CNY, but I had 3 D&Cs after birth, resulting in Asherman's, and my lining hasn't been above a 7 with estrase during IUIs. I know there's estrogen patches to add, but What else should I do to ensure that my lining would respond? Would a test cycle be appropriate? Well, absolutely a test cycle would be appropriate. More and more, we're looking at the endometrial receptivity assay, the ERA, which is allowed in every state in America except in New York, which is crazy. But we're still working with docs around the country that they can help us help you get the test that could be valuable. And technically 7 millimeters or greater is an adequate lining. Look at natural, and if you haven't had a hysteroscopy to look inside and make sure the cavity looks normal, and a saline sonogram, and even HSG to make sure there's no hydrosalpinx, I think those are real important things. Keto, reduce inflammation. Remember, the inflammation in the pelvis affects the uterus, the ovaries, the tubes, the testicles, all of it. So you got to change the internal environment. But 7 millimeters is good. And if estrace, oral, vaginal, a patch, a shot isn't working, think about letrozole, think about gonadotropin stimulation to prepare the uterine lining. And always, sometimes you have to step back to more natural in the process. So thanks, Anita, for your question. And I'm assuming everyone's hearing out there, and I'm always looking at making sure we're getting a good view in the process. And let's see here. Anita Francis. All right, we have been trying to have a baby for 4 years. I had a lap in May of 17, found a little endometriosis on my bladder, colon, and ligaments. I did hysteroscopy in October and all was good. Have had several chemical pregnancies and just had a recurrent pregnancy loss. And I'm assuming that's the testing and all looked good, looking at thrombophilias, immune testing, looking at your genetics and chromosome profile, doing an endometrial biopsy and looking at whether or not there's evidence of inflammation. And quite often, 2 to 4 week course of antibiotics can really be helpful in the process. I've had all the required blood tests, other testing CMI suggests, all good. Had a failed fresh last month with us. What else to do and suggest? Endometrial, ERA. So absolutely, I think looking at those things, and if you didn't do the 30-day antibiotic, I think that would be helpful. We're looking at plasma-rich, platelet-rich plasma infusions into the uterine lining 1 to 3 months. I'm still waiting for New York State to give me the A-OK, but there are some other practitioners that are doing it, and it may be the next step to kind of really try to help with that inflammation. We're also adding and looking at leukocyte immunotransfusion, LIT, so that's the male partner's white blood cells are injected under the skin. It's an allergy shot essentially, and there's a lot of evidence that it probably is helpful. The problem is it's not allowed in America, so we run away from it. But we've had patients from around the world have it done, and we send people to Markham Fertility with Mike Vero in Toronto and Nogales, Mexico. And one of our patients on our way across the border in New Mexico, the border guard asked where you're going, and they said for this treatment, he said, my wife did it and she had a baby. So I always ask others, what are they doing? What's the secrets that people are using? And really, it's always hard to know, but be open to all possibilities. IVIG, intralipids, Lovenox higher dose, prednisone. We're recently looking at Humira and Plaquenil. We've used both of them, and there seems to be some improvement in those. And then really narrow the foods. We probably have a significant number of allergies in our body, so you got to really keep abreast of that. So I hope I've helped there. And again, if we need to have constant communication, sharing the stories. And Tina Marie, thank you very much. And did what's ladies call the kitchen sink protocol with you lots of eggs and embryos that turned into only having 4 from that 17, 1 frozen now, and let's see here, have epilepsy, hence we took a break. So remember, epilepsy is inflammation, and the ketogenic diet, you got to really go strict. It really seems to help. I'm on, and how dangerous could that be? Haven't had an episode in 6 months. estrogen priming meds, EP med. Oh, let's see, epilepsy meds I'm on, and how dangerous could that be? Haven't had an episode in 6 months, but meds still need to be there. Well, they're likely okay, but you got to talk to your epilepsy doc, and I'm not sure exactly what you're on, but there's so much inflammation going on, and the ketogenic diet was used long time, almost 100 years ago, to help cure epilepsy. So that may be the area to look at, but don't give up and keep on looking for those changes. Juanita, thoughts on Ovasitol? Been trying to conceive for 3 years, been on the ketogenic diet since August, have lost 43 pounds. PCOS, like to really try to conceive naturally, had 12 failed rounds of Clomid, have heard good things about Ovasitol. Just curious. Okay, so Ovasitol is an inositol, and there's a lot of evidence that it does better than metformin in reducing insulin levels and glucose levels. And so the whole idea here is that if you look up a glycation, Glycation, and glycation end products, glucose basically binds to every molecule, every cell of your body, and causes damage, which really leads to every disease we know: hypertension, diabetes, heart disease, cancer, infertility, and failed implantation and miscarriages. It's a pretty amazing story when you begin to read about it. And check out the book by Thomas Seyfried, Cancer is a Metabolic Disorder, and I've been really, really fascinated. So I've been recommending Ovasitol by Theralogics, and if you put in the CMI fertility code, and I apologize, I don't remember it, but if you ask it, we'll send it out, and they'll have it for you too. They'll get a little bigger discount on it. And I've been really amazed, and I generally say ketogenic, Ovasitol, and metformin, I think, could probably go away. And we've seen so many diabetics, insulin dependent and oral glycemics, have really, the diseases go away. It's pretty amazing. No more managing, but eliminating. And Renee, a shout out, thank you, God bless to you guys. Always really, really, really so grateful to all the shared stories. And listen, I'm learning from everyone out there. And Jessica, thank you to you and your family. And really a blessing, and through this holiday season, which is very difficult for those experiencing and feeling the pain of infertility. Again, you want to close up, at least pull out a journal and write about it. Share it with at least yourself, all right? And then find someone you can talk to. If it's a therapist, a group, or you're someone that you feel like you can just open up and share, it does make us all feel better. And a very hard journey. That's absolutely the truth. Frisian horse Mara, thank you. And Deanna, thank you very much for telling us how great our staff is, and they're wonderful, but we all make mistakes from time to time, and I just want to say we're working on it. We are working to be better and listen and teach all of us to not be distracted, but be more focused on what you're going through. So thank you. And Tammy, hi. Let's see, how often do you get embryos transferred from others? Listen, we're seeing embryos come in from around the world, more from America because it's a little more challenging to get from outside, but we offer a very, very low cost transfer and IVF costs, and we also offer full payment plans for up to 3 years. We're pushing it out to 5 years very soon. Just tell us what you need and how to make it easier for you. And I think the risk of shipping is very, very, very low. Nothing in life is without risk. And realize that if you lay on a couch and watch TV and you never go out, there's lower risk, but you're going to risk something happening there. So Tina, again, it's our pleasure. And Maria, 16 weeks, congratulations. Again, it's faith. And sometimes people come to us or they go to other people, but really we're working together. We'll work with your RE, your fertility specialist, your primary, whoever it takes. We're here to all work together to share the process and make it work for you. So again, we're sharing ideas that you can take wherever you want in this process. We work with Dr. KK in Chicago, a shout out, really always working to learn more about the immune system. We at CMY Fertility Centers really believe the immune system is the most important part of it, and the metabolic and the environment within our bodies is affecting all of that. So we work with intralipids, IVIG, steroids, so many different options that we're finding that for so many other areas of medicine, they've latched on and understand that the immune system is very, very important. And much of it is I call it a blanket approach. Rarely is there an absolute diagnosis to understand the why, but we are learning that it's a clinical diagnosis more and more and more. Tara, let's see, new patient consult in January. We're looking forward to it again. Just listen and learn the whole process. Begin to get your body, your mind ready. Slow it down. Ketogenic, Maria Emmerich. Check her out. Really, really helpful. And if I'm pronouncing names improperly, please forgive me. I'm really, really working. Renisha from Atlanta, and everyone in the South, Atlanta, down in Florida, Tennessee, all parts of America. We've just really been grateful to everyone. It's easier than people understand to travel. Our travel team, our global team is really working diligently to make it, again, accessible, affordable, and I believe our quality, it really is top notch. We're having a lot of great pregnancies, and if it's not working, we're here to work and help you keep at it, and again, don't give up. 3 IUIs. In the first 2, I ovulated between 14 and 16 hours before the IUI, and I'm in the 2-week window for the third now, where I ovulated 10 hours after the IUI. Let's see, where we're using frozen donor sperm. And I wanted to get your thoughts on which is typically better, to have the sperm there before the egg is ovulated or after. Well, why can't I raise my heart rate above 140 during the 2-week? Boy, let's take the heart rate. Well, listen, unless you're running from a lion or tiger, you don't need your heart rate 140 or above. Slow it down. Fight or flight, cortisol, epinephrine, increased inflammation, it's not good. It takes the blood away from our core. Remember, our core, uterus, ovaries, tubes, testicles, all of that. Rest and digest and go slow. And typically the trigger shot is going to ovulate about 38 to 42 plus hours. You want the sperm there ahead of the egg. And typically I recommend IUI, intercourse, 12, 24, and even up to 36 hours after the trigger shot. If you're doing natural ovulation, LH surge, you have your surge today, have sex today, and sex tomorrow. And what we're finding is that the more sex, the better quality, the better sperm, the better opportunity. But if you're using donor sperm, it gets costly for sure. I usually recommend to do it within the 24 to 36 hour window rather than the 12 to 24 hour window. But doing it twice really does, I think, increase the outcome significantly. So I hope, Renisha, that was helpful for you. Hey, Kim, how you doing? Patient of yours, 53-year-old gestational care for my son and his wife. Wow. Thank you for the shout out, and share the stories. We're all really trying to help people understand that it's persistence, a positive attitude in the face of really the most struggle. And I've always said in life, those things that are the most valuable seem to be the hardest to obtain, and you seem to be pushed down and pushed down and pushed down. Try to get yourself up, dust yourself off, and then move forward. But that's why the support group is there, and all of us are here to share in the process. All right, Louise, hey, shout out. And please, again, and anything I can do to help you guys, please let me know. Carrie, medications besides metformin for PCOS. Again, I'm really finding that the ovasitol and inositol is better tolerated than metformin. It's non-prescription. So if you get if you get the ovasitol through Theralogic or inositol through other suppliers, and keto, and I also use the intermittent feasting, 12 to 24 hour food or feasting. So I recommend dinner only and then rest and allow your gut to digest and bring in all the nutrients. They all go to the liver. That means all protein, amino acids, all carbs, simple sugar go to the liver, where they must be processed in the refinery and converted to fat. So that'll get your glucose down by the morning time, and it'll give you the opportunity to be more vibrant and energized. It's the glucose that flows through your body at too high a levels most of the day. So the inositol, ovasitol, ketogenic diet. We also add low-dose naltrexone, or LDN. And there's some great literature out there. And Phil Boyle in Ireland's been using LDN for a long time. Look at the LDN book, low-dose naltrexone, 3 to 4.5 milligrams. Sometimes we'll start at the 1.5, then go to the 3, and then go to the 4.5. It's a prescription. It's needs to be compounded, but I really think that's the other third thing to add to this process. And don't forget, yoga, meditation, acupuncture, Tai Chi, group events, and slow it down and go for a walk and enjoy what's out in nature there. I hope that was helpful for you, Carrie. And Kate, how you doing? 2 embryos versus 1, not doing PGS testing, male factor, due to cancer. All right, so in general, 1 is going to be the sort of the dictum. If you're doing a blast transfer, that's day 5, 6, or 7, and it's 1, definitely if it's a PGS normal embryo, 1, although a PGS normal embryo doesn't mean it's normal, and a PGS abnormal embryo may not mean it's 100% abnormal either. These tests are probabilities of abnormality, but they're not exact. So in general, under 35, 1, first cycle 1, second cycle 1, third cycle or more, that's when the conversation may be, well, might be 2, but 2 does increase risk. If you're over 40, then the 2 over 43, 3 may be reasonable, but you have to individualize it. You have to have the conversation. You have to look at how many cycles, how many failures. But I don't believe you have 2 embryos, 1 bad, 1 good. It's going to kick the other one out. But again, we have a lot of stories, but having the absolute answer is really, really kind of tough. Bianca, 2-week wait, put in 2, 4-9 and 4-8. Want prepared for hard. So it's a hard wait for the beta, isn't it? And thanks for your comments. Let's see. We got 4 mature eggs and only 3 fertilized. Is that a low number? Well, you know, it's all over the board. There's a lot of eggs that have only a few mature, and a few eggs that have all mature, and it runs the gamut. It could be what's going on with your eggs, with the stimulation and the preparation process, the environment. It could be related to we need to change it up on the trigger, at a dual Lupron, at a little HCG. But 1 cycle isn't enough, unfortunately. But if whatever you're doing isn't working, I always say you got to look at it and consider changing it up. I'm not one to say go right to donor eggs because you have to be patient. And I've seen people with 2 eggs, 1 embryo, and a baby at 42. And IVF failed twice, no eggs at 44, ketogenic diet, baby naturally. So again, we look at things with our eyes And really, they're really not so good. They're perception-based. But we have to look at the possibilities and list them out and work to change as many things as we can. And sometimes letting go. And I've seen some that have just quit, let go, gave it up to God, and bingo, it happens. And I know we have this conversation, and the give up part, again, give it up is sometimes the right answer, but patience and persistence and a conversation in it is really helpful. Hey, Amy, how you doing? Consult in Buffalo, HSG and saline sonos were normal. Husband's semen normal, IUI next cycle, and unexplained is really, I call it idiopathic. It's kind of like we're idiots. Unexplained in general is inflammation. It's most commonly caused by the stress in our lives, but it's more commonly caused by the food we put in our mouths. And almost everyone that I know eats a high carb, same protein, low fat, and that's likely the killer, the disease cause for most everything we experience. So I know I'm a Dr. Kiltz, broken record. Like, really, can we stop talking about diet and food? Well, let's talk about Ferrari fuel, because we're all Ferraris. We're we're all the most valuable, irreplaceable. That's it. And we treat ourselves like Yugos. Look up a Yugo if you don't know what it is. But really, we've got to change it up. What you put in here and here, you're responsible for what you put in your shopping cart, what you put at home, and what you take out and consume. It's simple, but it's just practice. 21 days, a new habit. We can all do it together. And I've just seen it so much that I know it's the one thing. You control this and this, not me. And really keep it going. Keep it going. And so, listen, keep having sex, IUIs, and when those aren't working, don't forget the laparoscopy, hysteroscopy for endoadhesions and inflammation. You got to clean the gut out, and then and that's where IVF is. That next level comes. All right, Jessica, how you doing? Thanks, and remember, it's helpful for all of us to share the word, affordability, quality access, and it doesn't always work, and believe me, always working to do better, and share it around, share the video with friends and with people you haven't met yet, and the likes. Really, we really appreciate them, and I know this is quite a bit for so many people to be dealing with. It seems like, why do I have to deal with this problem? And I imagine that every problem I have is somehow a gift from the Creator to help me learn something, teach me something, be patient with something. And I know it seems crazy, but He's gifted me a lot of problems in life. And from all of those, I've learned how to take it up a notch. Hey, Kim, how you doing? I am the least risky person I know. Haha, yes, very nervous about IVF not working the first time. Do you think it best to go with the guaranteed program or the multi-cycle program for someone who really wants the peace of mind? Way less stressed if I know it doesn't work. I have. So we do have a guaranteed program. That means if it isn't successful, you give either all or part. There's some qualifications based on age and AMH and male factor, but we're really, it does help in the process. And we know that if it doesn't work with that funds, you can use those either for adoption or looking at some other modalities for success. And so both are reasonable. It might be to do a cycle at our single cycle discounted plan. We're holding our $3,900 IVF pricing. So many people locally have coverage for meds and monitoring. You can carry the monitoring if you want to pay a little. That we do have a self-pay monitoring, and you can add that to the IVF $3,900. and take it out over up to 3 years. We are adding a $250 frozen embryo transfer fee from frozen embryos from that cycle, but the actual fresh transfer and the year of storage is going to be included in that. And really, we're working really hard to keep our costs down and not pass all these extras. You can add things like embryo glue, like a uterine wash, Pixie, with additional costs if you find and think they're valuable. And we do add them because sometimes it's that next level to add to the process. Hey Bonnie, how you doing? Endometriosis can cause mitochondrial issues and chromosomal abnormalities. Well, it turns out that endometriosis, like pelvic scar tissue, like inflammation in the entire body through glucose, glycation, plant antigens, and other things that get in our body and cause a generalized inflammation, first in the gut and then everywhere else. It causes mitochondrial damage. And that damage affects our energy. Cells need a certain amount of energy in order to function properly. And that inflammation gets not only in the cytoplasm, but in the nucleus. So nuclear inflammation is going to damage the DNA. And so it is likely the DNA damage is a result of the cytoplasmic nuclear inflammation caused by what we put in our body that damages sperm cells, egg cells, support cells, every cell of our body. And the quinine story, there was an article in the New York Times about a woman who was taking a drink with tonic water, and unbeknownst to her, there was an allergic reaction that caused kidney failure. It took a few months, but the kidneys came back. And my bet is the same problem is happening to early diminished ovarian function, sperm abnormalities, ovarian uterine abnormalities, tubal abnormalities. Everything we're talking about is mitochondrial damage. And so that's why I'm a broken record on inflammation and reducing the inflammation. And the interesting part is that the idea is that the liver's function is to process all amino acids and all sugar and convert them to fat. But because we're eating 24/7 and we're filling our gut with a high carb load, the sugar cannot be reduced fast enough. It damages the pancreas and the liver. And so our glucose levels are in the 80 to 120s if you're pre-diabetic. And if you're diabetic, you know it's in the 120 to 200s and plus. And so by removing the inflammation, and I know this is a long-winded answer, and that's why I talk so much about LDN, the keto diet, Ovasitol, because it's a metabolic disorder that we need to shift this. And I've seen diabetes, hypertension, irritable bowel, every disease process go away. AMH levels and ovarian function come up and sperm function. So it is really, by removing endo, you'll help it. But remember, the endo damage is likely just another inflammatory process, but it's the visible thing that we think is caused by, in the ovary. I bet it's still a bowel problem because so much of the endo we find on the left side for the woman, and that's where the descending colon likely is having the highest amount of fermentation, inflammation, and damage and disease. So I hope that's helpful. By getting rid of endo, by getting rid of inflammation, you'll boost the ovarian function by reducing the damage to the mitochondria. And if you read Thomas Seyfried's book on cancer as a metabolic disorder, he talks about Otto Warburg, who gave us really the story nearly 100 years ago that glucose causes cancer. Glucose causes probably the majority of our diseases. And until the last several hundred years, even 2,000 years, we did not have easy access to the amount of carbohydrates. That means frequency, amounts, volume. and we certainly didn't have as much access to ground grains, seeds and nuts and oils. Bad. Hey, Kristen, Jessica, PCOS and endometriosis, 1 tube, start Clomid today. So Clomid or letrozole, we use them interchangeably. We're using a lot more letrozole for Mara. It seems to not have as much adverse effects on the endometrial lining. But if you've removed a bad tube, it can help tremendously with the good tube. And interesting, 2 ovaries in 1 tube, the egg from the opposite side can be picked up by the other tube. So if you're going through ovulation induction and a trigger shot, if it's on the opposite side where you don't have a tube, then you can still potentially get pregnant. So take advantage of those cycles. Hey, Carrie, how you doing? Let's see, homemade keto chicken taco soup. It's the best. And again, Maria Emmerich, and give her a shout out. Go on to Maria Emmerich's and befriend her, check out her Facebook stuff. And we've learned so much, and we've working with Maria Emmerich. Check out mariamindbodyhealth.com. We're hoping to bring Maria out again, and we're working on a fertile keto food plan. And I don't like to use the word diet because, boy, it doesn't sound good for any of us. And I grew up in LA, and really Mexican food was my life. And I really learned I made chili in medical school and sold it, and really learned that, our social nature is food. And doesn't matter what your cultural social norm is, you can find keto there. I know it. I know that I'm a little narrow crazy, but I'm testing something out to share it with you that at 61, no exercise, and I've really seen some amazing changes. Although I made dinner for my friend Steve last night, a baked potato with lots of butter and sour cream, and I also made some sautéed zucchini in ghee, and then some garlic and some Parmesan cheese. It was awesome. But again, if you narrow the timing and simplification of those carbs, it really can make it a lot better for you. The trick here is get rid of the complex stuff, and you gotta clean it and cook it to kill those microorganisms that I think are partly to blame. And we do not need a lot of, we don't need any carbs. And bacteria and probiotics, I believe, are bad for our guts. There is really no prospective randomized studies in humans. And remember, we're not rats, mice. You can't look at the same. We're much more like lions and tigers and eagles than we are like pigs and cows. I know it sounds tough. If you're a vegan vegetarian, there are some ways to do this. And so I'm not here to be against any food plan. You have to be open. All right, first thing to do is you gotta search it out. Andres Seinfeld and Diet Doctor is really great. And so just keep an open mind. And so thanks, Carrie. Luis Augusta, thank you very much. Make progesterone, okay, how to make progesterone low because the nurse says progesterone is high. Well, the problem with these levels is we don't know what too high really is. A lot of people naturally have higher progesterones and estrogen levels. I liked in a medicated cycle, we should see the progesterones above 20, estrogens above 200, but there's a lot of variation. Natural cycles typically above 100 and above 10. So, but again, it's natural when the progesterone rises, the estrogen drops. And there are a lot of factors that affect that. And we're seeing so much variation in TSH, and thyroid function is likely that there's some assay interference in this. So make sure that you're really making sure that TSH is less than 2.5, and we're following it on a weekly basis to really try to manage it and keep it down as best we can. So I know that sometimes these things get away from all of us, and we're really, really, really working to improve the process.
Oh, and DHEA, 75 milligrams a day in those with lower ovarian quantity, HGH or human growth hormone to boost quality and quantity, we think. And we're moving more and more to a 30, 60, 90-day human growth hormone, even for the guys, to boost. And don't forget my massage and acupuncture and our CMI Healing Arts. We have a lot of integrated specialists to help with acupuncture, yoga, massage, and we're working to get our Buffalo location with the Healing Arts a little bit more integrated, but that's coming up pretty soon. Right now, the majority of our clients from all over the world come to either our Syracuse Fertility Center or Albany, where we have our full labs. I'm currently in the process of redoing and adding a second lab in Albany as we're gearing up and seeing more and more clients. We're doing a lot of egg banking, and our $1,900 egg banking is really something that no one else is doing right now. And we're working on, we need more egg donors. So if you have friends or anyone, please share and help the gift of life, egg donation and sperm donation, embryo donation, the gift of life. You see how important it is to building families, and we're so grateful to all that have done that. I'm working on some ideas of if you donate up to 3 times, you'll get a free egg banking cycle also if you qualify. So just some interesting ideas, and we're always open to newer ideas. And our financial team is really working diligently to help you get more information. We are doing full financial plans, and you can take it 12, 24, 36 for all of your costs from CMI Fertility. Currently, we're using Cornerstone for our pharmacy, and we're just talking to Metro Pharmacy with Joe to get some help and assistance on some of the products. So we're really looking for sharing and shout out to how do you get fertility and make it more affordable? Well, really for 20 years, I've been dedicated to this and always looking to invest back into the infrastructure to keep the quality high. It's not inexpensive. It's more affordable. And we're dedicated to that. And again, thank you. Amanda, how you doing? Mavo, thank you, a pleasure. And again, I'm sorry if I'm not pronouncing everyone. Again, shout outs, likes, shares. We're really appreciative. And I'm working to do these at least one Sunday a month because hopefully more and more people are available. Once you've watched it, share it with others. And especially before they're experiencing infertility, because our job is, if you're contemplating having a child, how do you help make the Ferrari really feel and act like a Ferrari? And it's what you put in here, and change the environment. We're going to help improve people's fertility. And the other is, we've typically, our clients, once they're pregnant, we send them off to their OBs early on, but we're looking to carry it even longer, 14 and even longer for support, because the keto diet is important to stay with it. Keep the LDN going, because when you reduce inflammation, you increase the chance that you'll deliver a healthy baby at term. And we're finding more and more that diabetes is so much of the problem. Hypertension, diabetes, and gaining weight. Now remember, it's not the overweight that causes the problem. It's just an indication that the high glucose environment is causing the problem. All glucose, all protein amino acids need to be converted to fat in order to use them as energy for the cells. Our cells never use sugar or protein directly, it's indirect, and the liver must be functional and the pancreas to get the insulin. Always grateful, Amanda, how you doing? And I'm working to share Mind, Body, Smile, some podcasts of positive energy, sharing the energy for all of us, to take all of those that are feeling the pain, the discomfort of this process, and come together and boost us all up, make us feel better, to keep at it don't give up. But we want to run away. We all do. We all feel it. I get down and depressed and sad from time to time. Tia's, hey, Dr. Rob Kiltz, everyone's throwing it out there. You're always positive. What are you doing? Well, I'm not always. I feel it sometimes. I get down and depressed a little bit when it's not working. I feel the pain, but I'm digging into the books, into the podcasts. I was watching, I went to a Tony Robbins retreat about 5 years ago with some friends, walked on fire, felt good, we're all energized. And so do something that's going to energize you. Randine Lewis, she's got some really great stuff. My good friend Diane Credenza also, with my friend Paul, really some great stuff that we're all sharing. It's always the connection. Let's see, I have PCOS, my 3-day of Femara. So again, I usually recommend 5 days, 3 through 7. You can do it earlier or later. It may not matter so much. And we're usually triggering about 18 to 22 on Femara. But for some people, when it's not working, it may be more at the 16 millimeter level. And for those who have lower responses to the medications, earlier trigger may get a better quality. So right at 16 millimeters, even though there's some smaller, trigger with 5 to 10,000 of HCG or 250 of Avidril. And if you're over 190 pounds, using the 2 Avidril may be necessary to help that trigger and help you ovulate. And remember, there's only one sign of ovulation, that's pregnancy. Everything else is just a presumptive of the process. Metformin for 5 years, nothing for you. Basically running my life, all this stuff runs our life in one way or another, and we get very frustrated in the process. Last 3 years have said, I need it because it will help me. If it ain't helping, get rid of it, I say. It causes diarrhea, stomach upset. And listen, Maria Merck's keto, LDN, Ovasitol. I do recommend the Ovavite and the Theramegas through Theralogics for women. Changing what's in the gut. And look at Jason Fung and Jimmy Moore's stuff on intermittent fasting, which I've changed the term, call it intermittent feasting. Again, less is best for the Ferrari, and you're a cruising Ferrari that's in the showroom, but not a racetrack. So I don't love metformin any longer. I'm really working. Let's work towards natural. That's the trick for more and more of us as we're looking at something very, very, very different. All right, Kristen, 46 years young, cut off by insurance, unfortunately, and they won't cover either donor eggs or your own. 2 rounds of IVF. I feel like a failure, I know, and 30 grand in debt. Hard. We are seeking. And read a couple of positive, uplifting books on Think and Grow Rich, The Power of Positive Thinking. Don Curtis is one of my favorites, and he's got some really great stuff. If you haven't listened to or read The Alchemist or The Secret by Rhonda Byrne, and these things have changed my life. I had one couple that came to me one day and said, Dr. Kiltz, I'm so glad it didn't work with you. I was hurt. And they showed us a picture of the beautiful baby that came to them through adoption. Do not give up in this process. This is where faith, give it up, have faith, read the good books that we've all been shared. There's so many good books on faith. Doesn't matter what your religious belief is, or it's just, I'm spiritual. By putting something more positive in here, you'll change the internal vibration. The mitochondria will feel better. Yes, better mitochondria, better health and wellness. and we can help all of us. And listen, there are people out there that says, hey, I've got some extra embryos. They're sitting either at CNY Fertility or somewhere out there. Share them. The more we share, boy, isn't it amazing? And believe me, we all go through down, feeling miserable times. We're human beings. And I always wake up nice and early. Recently I was listening to Eckhart Tolle. If you haven't listened to The Power of Now, and stillness. Today was my day of pottery studio doing some clay work. I like to paint. I like to listen and read and draw. I love this. I love sharing. I love working the puzzle of it all. And really, we don't control any of it. Some higher power well above all of us. But the belief is the vibration through the mind. And you have to read a little bit of James Allen, U.S. Anderson, and the 3 Magic Words. I found them so amazingly valuable. Amber, let's see. Success rates for IVF. Success rates for anything all over the board. You go to SART or CDC and you try to understand, they're between 10 to 20 and 70 to 80. Well, it all depends. Depends on who we test and let into the process. You may not be seeing all the numbers out there. I've seen those people that I thought were a slam dunk, it doesn't happen, and those people that were no way, and wow, it happens. Every egg, every sperm, every embryo needs to be given the opportunity to make a baby, all right? And there are some basic parameters to give you a ballpark of where you're at. You can go to the SART website and ask the question. It's about a 30% delivery per transfer. You got to get embryos to transfer. You got to have eggs, sperm, and you have a uterus to put it in. Really amazing, the recent delivery of a U.S. baby from a uterine transplant. It's going to be more and more mainstream one day. I think it's very helpful. Look at gestational carriers, look at egg and sperm donation, embryo donation. But I tell you that IVF success, you got to participate and take a risk of being 100 or 0. That's the challenge. But under 35, it's about 40% per delivery. And over 42, it's in the 5 to 10% range. But you're either 0 or 100 in every cycle. And by doing something, you're apt to get something. You learn, you change it up, you get what you wish for, you desire. So don't let it go. Again, tell us where you're coming from. Share it out there from the Pacific to the Atlantic, all the way down south. We've seen people from South America and Australia, Philippines, from Africa, from the Middle East, from Russia, from Eastern Europe and Europe. And so grateful to everyone traveling this world, coming to visit us. Again, very, 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 very grateful. And I'm going to skip down to the bottom for a second. And again, so grateful. I'm sorry if I'm not able to get all the questions. Listen, you have to have faith and belief, and you got to slow it down. If you're having regular cycles, you're likely ovulating. And change what you put in here and you put in here. Get the test to see if your tubes are open. And interesting, by doing the HSG or hysterosalpingogram, especially adding oil contrast and a little antibiotics, you improve a lot of natural fertility. Guys, you gotta change it up also. Get rid of alcohol, tobacco, and go keto. Again, keto is king for all of us. If sex isn't working, and remember, you got to take care of your partners. You got to share love and faith, dates, and you don't have to throw expensive gifts, but sometimes just a card, a message, I love you, thank you. Shout it out for all of us. And if it's not working naturally, that's where this conversation comes in, and talking to someone. And I always say, give it up to the man, to the woman, to the faith. It's in the brain. It feels better for all of us. And Christina, thank you to you, and thanks for the shout out. Changing the protocol, adding human growth hormone, low-dose HCG. And interesting, we talked a little bit about HCG, whether to do a wash and then to add it before the pregnancy test. I don't love the HCG before the pregnancy, but once you're pregnant, the booster may help reduce miscarriage. The HCG wash and the Neupogen may help boost implantation, again, along with all the other things that we're doing here. And we will turn no one away. We see so many who failed other places, and those are all great places. We're just all being open to something new and different in the process. Amy, let's see, still trying naturally. That's it. Never give up. Always keep at it. Wondering if having a fibroid in the uterus found last sonogram would inhibit implantation, make it harder. So fibroids and inflammation are signs. Fibroids and endometriosis are simply signs of inflammation. And those inflammatory markers are a sink of inflammation they're basically communicating with all parts of your body. And I believe that it affects blood flow. It affects the inflammatory markers and cells that are just all over your body, inhibiting implantation, increasing platelet aggregation, the complement cascade, causing microvascular blood clots. And so I often recommend removing those fibroids, even though they might look like they're not in the way. They're not distorting the lining, but they, again, could be stealing away normal blood flow or increasing the inflammatory environment in and around where that embryo is looking to implant. So I do recommend removing those if you failed, and that's the only thing that you're finding. Size seems to matter, more than 2 centimeters, more so, closer to the uterine lining. But again, I've seen some that we thought didn't matter. I removed it, and then pregnancy and delivery happens. Cara, thank you very much. 40 milligrams Lovenox for an FET. Day of transfer, I've had 2 miscarriages from 2 naturally conceived pregnancies, but don't have a clotting disorder that you know of. Again, all of us have inflammation, and the microvascular clotting is happening to all of us. Some have a blood test marker, but most do not. Good to take and prevent miscarriage. I believe Lovenox 30 to 40 milligrams once or twice a day. If you've had a lot of miscarriages, I would go to the 40 twice a day and the prednisone 10 twice a day, the aspirin 81, and again, LDN, keto, it's the king. Again, increase the butter, bacon, the baby diet, bacon, eggs, butter, beef, bam, baby. If you're a vegetarian, cream and butter, simplify the carbs, separate them out 12 to 24 hours. And I believe that seeds and nuts and plant oils are not good for us. So I hope I answered that for you. Couple more, and then I'm going to just kind of chill out for the evening. All right, Amy, I've already answered that. And Anna, yes, an office in Ithaca would be nice. We're really working to help our clients from around the globe, helping the your OBGYNs help you better. And in so many ways, you're the one that has to take control of this. The more we help get the process to be taken care of from home, even a home ultrasound device, ways of testing saliva, know where you're at, and helping our global travel team help you in better ways. That's one of the things I'm really working on. And Lori, how you doing? Thank you very much. Again, share, like, tell us where you're coming from, help support the whole family that's out there. And again, let's all give it up to the support team, the CMI Global Fertility team. But remember, share with your RE, your OBGYN, your primary care, how what you're doing here and here really matters. And sometimes I've seen so many patients share with me that has helped me. So again, God bless. Thank you so much for participating on this Sunday evening. My best, if you're taking some time in the holiday season, even some quiet stillness time, rejuvenating. So again, thank you. God bless to you. Have a great, great, great holiday, even in the challenges. Dr. Rob Kiltz, enjoy.